think the really wonderful thing about working with the American Heart Association is that we get really involved in research and our systems in our hospital. But collaborating with them, they're helping us get that message out to the community so that the patients are calling 911 and getting to the hospital in time. And that's been the biggest barrier. FAST, F-A-S-T, FAST. What we really wanted to do with it was represent our team. Because the University of Utah, we have such a wide-reaching area. We wanted to have that presence and show that this is the message. If you are having a stroke, call 911, and we're the team we're the stroke army that's going to take care of you. In 2004, we joined Get With The Guidelines. It was the same year that I came on staff as a staff nurse in the neurocritical care unit. And having watched the care of our patients over the last decade has been pretty remarkable. So the first few patients I would take care of, we were taking care of a lot of patients where it was too late. They were coming in, they were permanently disabled. And over the years, in working in that unit, I got to see that shift to, oh, now here's a patient that got TPA and now they're better compared to that report that they got before. Well, obviously, so the need for having data and making data-driven decisions and really having a clear way to track our quality metrics and figure out which problems are the problems we need to solve in order to get stroke care to patients in the right time. I still remember getting a report on this patient around 2008. All of her deficits, she was completely aphasic. She got TPA, and she was the first patient I took care of. She gets to the unit and she's already talking, and within 2 days she was discharged from the unit with a modified Rankin score of 1, and this was starting from a really disabling place. Starting about that time, we started seeing more of these patients coming through the critical care unit that we're actually going to they're already looking better before they get to us. And so that's been a big difference. The reward is a lot. It's meaningful to us as a system, but I love that it also recognizes that work that my team is doing in order to capture that data. Having the award is meaningful for us because it tells us that we're delivering great stroke care, but also just for team motivation, it's pretty amazing. Absolutely, absolutely. And I think that is, it also helps us build trust with our community when they see that American Heart Association working with us. That's a trusted message out there, and so it definitely helps.